In Southern Sudan, the maternal, newborn, and child health situation is really in a state of crisis. In fact, today, 1 in 6 women can expect to die in childbirth in her lifetime. A young girl is more likely to die in childbirth than she is to actually complete secondary school. 1 in 2 women actually will die or become disabled in childbirth in her life. 40 years of war out of the last 50 years, and infrastructure has been entirely destroyed. Another reason is that it actually is an area of the world that carries the highest burden of disease. So it has actually, Southern Sudan has all of the world's diseases. It's the only place on earth that has all of the world's diseases. The Ministry of Health specifically asked us to take on a program that is quite ambitious in nature, but to train frontline health workers in maternal, newborn, and child emergencies. Designed training that's action-based training, and we designed kits, so kits of commodities, so tools that they can have. They're reusable since the supply lines are so poor. So specific kits that are targeted towards saving mother and babies and children. This bag is what each frontline health worker in Southern Sudan will receive. And in this bag, there are a number of different tools. And here, some power, and where most babies are born, you can imagine that this little device can provide light for both delivering a baby and taking care of a mom and taking care of a child. Marked off the blood pressure cuff so that they can understand without having to memorize exactly at what reading do they need. We've equipped the frontline health workers with a small newborn ambu bag. And this particular one is designed, it can be boiled, and we have these small devices which are used to clean the baby's mouth out, so when they go to take that first breath, they don't take and swallow or aspirate into. What was so interesting for us and so challenging for us is to create checklists for people that we know are illiterate. In Southern Sudan, 87% of the population is illiterate. So all of these checklists are specifically designed so that frontline health workers can rapidly look at a series of pictures that will remind them of the priorities and the questions they need. Balloons are very expensive. We use them in the developed world. We use them here in the United States. We use them here at Massachusetts General Hospital. We've designed a uterine balloon that we're working together with MIT on, and people in Seattle at an organization called this is our design. And essentially what it is, it's using a catheter that's already in the country. And it's a catheter that can be boiled and used again. We tie a condom to the end of it, and we have found that we can actually, with water, blow this condom up and exert pressure such that bleeding can actually be stopped. We've been training frontline health workers to do this. Now this entire device, which can be used again over and over again with a new condom, this device costs less than $5. So we've focused on the major killers. So we've kept it very, very basic, and there are specific areas where we know we can make a difference if we can translate the knowledge as well as the tools and skills. And so, by and large, we're not going to save every baby or every mother, but we think we can make a big difference by using new skills and specific tools.